we start to look at, treating the back and things like that, main thing to bear in mind is you've got to first, before you start any kind of treatment, is get more as accurate diagnosis as possible. So first thing you need to determine, is it spinal or is it the muscle that you're actually treating? Because each one is going to determine what points you're going to use. Yeah, so specific points will mainly address the muscle. Specific points will mainly address more spinal and structural. So that's going to be one of the key things. So some of your strongest points may well be in the face, but most of your strongest points is not necessarily going to be here in the back. It's either going to be in your hand, your face, or down here in the leg is where you're going to get your optimum treatment from. Okay, so normally if I'm treating back-wise, I'll put all my distal points in first, and then I'll do anything what I'm actually going to do with regards to the back. Okay, so first things first is, as I said, you need to just palpate around, determine, like if you're looking at something like urinary bladder 51, for example, that's a trigger point as well as a classical acupuncture point. So that is going to be quite an important point to take into consideration. Reason being is if you look at around about 80% of cases, all cases of back pain will involve that particular trigger point, yeah, or classical acupuncture point, however you want to look at it. So therefore, it is wise, as part of your assessment, is to palpate that point and determine as to whether that point actually needs treating, yeah. So easiest way to do that is to, I'll do it from this side, is to just bring the legs over, bring the arm up, put it onto a slight stretch. Urinary bladder 51, if you come below spinous process of L2, you're looking at 3 centimetres approximately lateral to that. And then what you're basically going to do is just come in onto there. Oh yes, you can see it wincing nicely there. And just apply the pressure. So what I'm saying is if that's active, that definitely needs to be treated. Okay, keeping them in that position. Again, I'm just coming across. As you come straight across, you're going to be below spinous process of L3. Okay, so I'm on to the spinous process at L4. So if I go up 1, I'm below spinous process at L2, and now I'm going to come lateral to that, about 1.5 centimetres, which brings me on to urinary bladder 23. Now if I apply pressure into that, again, that is also a trigger point, urinary bladder 23. And I'll palpate down. Again, if that's active, with being a trigger point as well as a classical acupuncture point, then that's going to be one of the points that I'm going to choose. Come back to my L3 and I'm going to come 2 vertebrae down. So now I'm under L4. Okay? I come 1.5 centimetres lateral to that. That's going to bring me to urinary bladder 25. Okay? There's a classical acupuncture point, but also that is a trigger point. Yeah, I apply pressure onto that. If that is active, that's going to be one of the main points that I'm going to actually utilize. Okay, so again, I can either apply pressure and then needle afterwards. All depends as to how you're actually going to go about treatment of that. So again, that's going to be a very brief, quick assessment to determine what points I'm going to use, depending on as to how the patient's actually presenting. Same again, if the psoas muscle's involved, I turn the patient over, and then you've got your urinary bladder. Do you want to just quickly turn over for me? Not your urinary bladder. So again, if I think the psoas muscle's involved, you come to the navel, just lateral to it, is going to be your kidney 15. About 1 cm below it is your kidney 16. Now they also sit over the psoas muscle, and very close to the psoas muscle trigger point. So again, I can palpate those to determine, ask the patient, is it tender? If tender, then again, they're going to be points that I'm actually going to utilize. So in quite a few cases, if the patient comes to you and they say, look, when I'm in the car, for example, if I'm driving and I go to lift my leg out the car, that's when the pain comes on. That is a strong indication that the psoas muscle is actually involved. Okay, so therefore, they'd be ones that I'll be applying pressure to. Needling wise, you don't needle right the way down to the psoas muscle. You're only going to go probably 0.5 centimetres in there, or you can come onto it and apply pressure until it's released. But make sure the psoas muscle's on stretch, and that's where you're going to get your best release.